What's up, ladies and gentlemen? It is Dr. Kenny. Welcome back to Neurosketch with Dr. Kenny. And let's zoom in on a bone we're using every day without realizing the humerus. This bone stands at the longest and the largest bone of the free upper limb, extending from all the way from the shoulder to the elbow. But you really know its surface features, the head, the tubercles, the grooves, and some other features. So let's talk about this bone in little more details. Let's have a little recap on the skeleton. So, as we said the other time, skeleton is divided into two parts: the axial skeleton and appendicular skeleton. And the appendicular skeleton is made of extremities, the upper and lower extremities, So today we are discussing the humerus, which is a part of the upper limb. So it lies within the appendicular skeleton. It lies within the appendicular skeleton, and this is the humerus. As you can see, this is the longest bone. Is the longest bone of the bones of the upper limb. Okay, so it articulates with three bones: the scapula, the radius, and ulna. Scapula, radius, and ulna. So it articulates with three bones. It's the longest bone and longest and the largest bone of the free upper limb. Okay, the humerus can be divided into three parts for the purpose of descriptions of some fractures. It is divided into proximal third, the middle third, and the distal third. Okay, so this is more for descriptions of fractures of the humerus, the fractures of the humerus. So without further ado, let's discuss about the surface features of the humerus, the surface anatomy of the humerus. So we're gonna see both anterior and posterior view, So this is anterior view and this is posterior view. So we're gonna move from proximal all the way to the distal parts of the humerus, discussing different surface features. All right, so this rounded elevation here is known as the head of the humerus. Remember, we said the head of the humerus is the one that articulates with the glenoid fossa to form the ball and the socket joint of the shoulder region. So the head of the humerus always acts as the ball, and then the socket is that part of the glenoid cavity. So, but every time you see the head, is for sure you're gonna see the neck. So every time you see the head, we always have a neck. So that is anatomical neck. This is anatomical neck of the humerus. This is how when the humerus was created. There was a point that was said to be a neck, and this is the anatomical neck. But it happens like due to different research that were published, the humerus is more likely to be fractured at this part. Okay, it's more likely to be fractured at this part. So for that reason, the humerus has got also another neck, but this neck is known as the surgical neck, to differentiate from the neck that was created from years. This neck was created, the humerus was created with anatomical neck, but it happens like the humerus is more fractured at this point, and so the surgeons referred this part as the surgical neck for the purpose of differentiating it from the anatomical neck. Never mind about that. Okay. So the humerus has also got some two elevations on the proximal part of the humerus. One is on the lateral, one on the medial. But one is bigger than the other. These elevations are known as tubercles. Okay, so because this one is greater than this one is known as the greater tubercle. So the greater tubercle, this one is greater tubercle because it is bigger than this one. because this one is smaller, is known as the lesser tubercle. Okay, the lesser tubercle. But in between the tubercles, there is a shallow elevation. Remember, like we have one on the left. I mean, one bigger than the other, but in between there is a shallow depression left. So this depression is known as the intertubercular sulcus or intertubercular groove, because it is between two tubercles. Intertubercular, between the two tubercles, we have the groove, or we have the sulcus, which is known as the intertubercular sulcus or intertubercular groove. But some people also refer it as the flow of the intertubercular sulcus, so it means the same thing. But you can appreciate that the intertubercular groove, the intertubercular sulcus, extends beyond the limits of the greater and lesser tubercles. You see, this is the greater and the lesser tubercles, but it extends beyond the limits. It extends all the way to downstairs here. Okay, so why it extends now, it is covered. It is between two bumps. It is between two bump-like elevations. The two bump-like elevation. One on the lateral, one on the medial, but they are bump-like elevation, so they are also called the lips. The lip, one lip, two lips. Okay, so one on the lateral and one on the medial. So one on the lateral is known as the lateral lip of the intertubercular sulcus, and then the medial one is known as the medial lip of the intertubercular sulcus. Again, I am tempted to mention the muscles that originate and insert into different parts of the humerus. Okay, but at this moment, it is more likely to cause confusion than understanding, and so I have decided to put this origin and insertion somewhere else. Okay, so I know it looks a little bit intimidating, but don't worry about a thing, because every little thing, it's gonna be alright. Alright, let's continue. So on the lateral surface of the humerus, we have the middle third. At the middle third, lateral surface of the humerus, we have a rough elevation, which is known as tuberosity. But because here is where the deltoid muscle will insert, this rough surface is known as the deltoid tuberosity. The deltoid tuberosity can also be seen because see a little bit on the lateral towards the posterior part, so it can be seen also on the posterior view. So this is also known as the deltoid tuberosity. Just below the deltoid tuberosity, there is an S-shaped groove or sulcus, S-shaped shallow groove, the shallow groove, S-shaped shallow groove, so which is called the spiral because of being S-shaped. So S-shaped for spiral, so spiral groove. But because here is where the radial nerve passes, it is also known as the radial groove. So it is known as the radial groove or the spiral groove. The spiral groove, the radial groove, they mean the same thing. Okay, it is radial because there is where the radial nerve, of course, together with the profunda brachii artery, will pass. But it is spiral because of the shape, the spiral shape. All right, so let's go back to the anterior view. Let's go back to the anterior view of the humerus, but now on the distal part of the humerus. Okay, so on the distal part of the humerus, we have these two elevations, one on the medial, one on the lateral. We call them the epicondyles. Epicondyles. So we have the medial epicondyle and the lateral epicondyle. The medial epicondyle, every time you see epicondyle, it's gonna be like a condyle-like elevation. Listen. These two, they are condyle-like elevations. Condyle-like elevation. Condyle means knuckle, so they are knuckle-like elevations, but we do not really call them knuckles on the humerus, but they are knuckle-like elevation, but they got the special names. They have their special names. But we see on the when I discuss the distal part of the femur, we see we have these condyles. So because we have condyle-like elevations, is for sure we're gonna have The epicondyle means the elevations that are above these condyle. So epi means above, epi above. So epicondyle. So this is epicondyle because it is above the condyle like elevation here. Okay, so this is the medial epicondyle and this is the lateral epicondyle. But the medial epicondyle is very special. Why? Because just behind the medial epicondyle is where passes a special nerve which is known as the ulnar nerve. Okay, the ulnar nerve passes by just behind the medial epicondyle. As a matter of fact, is that whenever you hit this part of the bone, okay, whenever you hit this part of the arm, the medial epicondyle, you get that a strange sensation, a strange loss of sensation on this the medial half of your arm, and of course the the little finger and the ring finger. Have you ever experienced that one? I mean, every one of us has experienced it at some point, and you can just try to hit a little bit medial and posterior part of the medial epicondyle, and you have this funny sensation. So for that reason, the ulnar nerve is also known as the fun bone. The ulnar nerve is also known as the funny bone. Why? Because when you hit the ulnar nerve, when you hit this medial epicondyle, you're gonna hit the ulnar nerve, which is gonna bring like this funny like sensation, the funny like sensation, tingling and loss of sensation on this medial half of the arm, and the small and ring fingers, which is actually funny. Even me, sometimes when I'm bored and I'm annoyed and bored, I'm gonna knock this this bone over here just to get that funny sensation. Jokes aside, it is known as the funny bone. So it's actually a nerve, but it's known as the funny bone because when you hit there, you get this like funny like sensation. All right. So that's a medial epicondyle. It covers the ulnar nerve. You can never forget about that one. So the fractures of this medial epicondyle, they're gonna result into damage to the ulnar nerve. Okay, and we see in later discussions how the ulnar nerve injury will present like. Okay, so let's now talk about these knuckle-like elevations on the distal part of the humerus. Okay, so we have one on the medial, one on the lateral. On the medial side, it is special and is known as the trochlea. The trochlea. Trochlea is this medial elevation on the medial condyle-like elevation, and this on the lateral one, it is known as capitulum. Capitulum. Yes, capitulum. Okay. So just above the capitulum and the trochlea, we have some shallow depressions. We call them foci. One on the lateral, one on the medial. On the lateral one is known as the radial fossa, and on the medial one is known as the coronoid fossa. The radial fossa and the coronoid fossa. Why are they called radial and coronoid fossa? It's because here is where the head of the radius will occupy in a flexed elbow joint. When you're flexing the elbow joint, the head of radius will occupy the radial fossa, and of course the coronoid process of the ulna will occupy the coronoid fossa. This is why I'm talking about. This is the coronoid process of the ulna, and this is the head of radius. Okay, so when you are flexing the elbow joint, this part over here is gonna come all the way to go occupy this part, which is known as the radial fossa, and of course the head of radius will move on in this direction to occupy the radial fossa of the humerus. So it is true that the radial fossa and the coronoid fossa are on the humerus, but the corresponding parts are found in the radius and ulna respectively. Okay, in other words, these the coronoid process of ulna and the radial head are the one that limits the extent of flexion. When you are flexing the arm, when you're flexing the elbow joint, these two bones will go to stuck into this part of the humerus, and so that will be the what maximum point of friction of the elbow joint. Okay, so same applies on the posterior part of the humerus. We have a little bit depression, and we call it the olecranon fossa. So it is also known as olecranon fossa because here is where the olecranon process of the ulna will occupy when you are flexing the elbow joint. Okay, this part over here, this is the olecranon process. I mean, we have our time to discuss the bones of the arm, the radius and ulna, but at this moment you know that this part is known as the olecranon, which is gonna like lock within the olecranon fossa to limit the extent of extension. Okay, so you can extend the elbow joint up to this point, because from there the olecranon process of the ulna occupies the olecranon fossa of the humerus, and so there is no more extension. All right, so let's talk about the orientation of the humerus. Again, I told you the other time when we discussed the scapula that at some point you're gonna be asking you an exam like, okay, what do you think? Is this the left or the right humerus? And so you have to justify your answers whether you say left or right. So you have to give reasons for why you have chose the part you have chosen. Okay. All right. So in orientation of the humerus, there are a few things to pay attention on. Number one is the head of the humerus. So the head of the humerus is pointing medially, but superior and a little bit to the posterior. The medial, superior, and a little bit to the posterior. Medial, superior, and a little bit to the posterior. But maybe if you say medial or just only medial, and maybe someone can understand you in the exam. So you can just say medially, but if you want to be more accurate, to say medial, superior, and a little bit to the posterior side. And of course, you can talk about the capitulum and trochlea. Okay, you're gonna say the capitulum and trochlea will face anteriorly, so they face anteriorly. But also someone can use the olecranon fossa, which is also okay. So someone can also say the olecranon fossa faces posteriorly, so it faces posteriorly. So how are you gonna answer? You have alternative of ways of answering this question, like, okay, what do you think? Is this the right or the left humerus? Okay, so you're gonna say, because in anatomical position of the humerus, the capitulum and trochlea will face anteriorly, and the head of the humerus will face medially, a little bit posteriorly and superiorly. So this this will be the head of what? This will be the right humerus. Why? Because putting all these features together, the head of the humerus points to the contralateral side. Okay, maybe you can use your own way of getting away from this with this question, but we have alternative of ways of answering this question. Okay, so someone can just say that way. Someone can say, if you put it in anatomical position, the head faces medial and the capitulum and trochlea faces anteriorly, so this one belongs to the right side. Okay, this one belongs to the right side. Someone can use the olecranon fossa. Putting in your anatomical position, the olecranon fossa faces posteriorly, and the radius and the head faces medially, posteriorly, and a little bit superiorly. So putting all this together, this humerus belongs to the right side. So you can have different alternatives of answering this question. So let's have a little recap on the movements of the humerus. And the movements of humerus also mean the movement of the upper of the arm. I'm sure you have discussed this somewhere else, but this is just as a repetition and just to be sure that you remember. So number one is a flexion of the humerus, or the flexion of the arm is when you are moving your arm anteriorly, and superiorly, anteriorly and forward. So, but we are considering the shoulder joint and not the elbow joint. Okay. So for example, when you want to press something in front of you, you are flexing. For example, when you want to press the elevator button. You're gonna flex the elbow, the shoulder joint. And then extension is like pulling the arm posteriorly, backward, pulling the arm backward, opposite of the flexion, backward. For example, when you want to you are talking to a phone and then you want to close the door, to grab the door handle and close and close the door handle, and so that is extension. So when you're taking your arm back to grab the doorknob to close, that is extension. Okay, so we have abduction and adduction. So abduction is movement away from the body. The movement away of the body, like laterally away from the body. And for example, is when when an eagle spreads the wings, as it starts to fly. Before it starts to to fly, it spread the wings. Okay, so that's also known as abduction. I know that spreading of wings can have some little meaning, but when the eagle spreads the wings, that is considered as abduction. Okay, abduction. So moving away from the body. But when you're restoring back the abducted arms, that is adduction. So adduction is like restoring back into the normal anatomical position. So medial rotation and lateral rotation. So the medial rotation, the humerus medially rotate. For example, this one here, and this humerus. When the humerus medially rotates, it's like it rotates towards the midline. For example, when you want to touch the other arm, so when you want to touch the other arm, is for sure you have to rotate the other arm to flex this one over here. Okay, and then the lateral extension, the lateral rotation is quite the opposite of the medial rotation. I'm sure you've discussed about this already, but I just want to make it clear for the discussion of the muscles of the shoulder region, the muscles of the arm. Okay, so lastly we have the circumduction, which is combination of flexion, extension, abduction, and adduction. An example of this example of circumduction is when a person draws a zero in space. A zero in space. So it's corny, like you see. It is a corny like movement that combines all those together, and that is circumduction. Alright, so that sounds like pretty much it from today's discussion on the humerus. So in case of question, addition, or comment, you can always write me an email, but you can comment on YouTube, in this YouTube channel. You can write me an email. You can follow me on Instagram and TikTok and Neurosketch with Dr. Kenny, and don't forget to subscribe and share this with your friends. And that sounds like pretty much it from today, and see you next time.